Edinburgh Compact Partnership established a partnership to develop better relationships between the public sector in the city and the third sector and voluntary organisations. It was the first in Scotland of the partnerships that brought together the voluntary sector as an equal partner with the police, with fire, with NHS, with the council, and with higher and further education, to all sit around the table as the community planning partnership for the city. So this is now 10 years of the first compact, and in developing the new compact action plan, we went out and talked to individual organisations across the city to say, what do you want now out of compact for the next 10 years?
Safe Zone is a service for people on Friday and Saturday nights within Edinburgh city centre, and between 10 p.m. and 4 p.m. this big yellow bus is parked outside the Omni Centre at Cathedral Lane, and anyone can approach it. It's a free, non-judgmental service that anyone can come onto, and they'll be provided with welfare and first aid and advice and support for any problem they're having. Anyone who's become vulnerable within the city centre can come along.
What we've developed here has become a lot wider in terms of community safety and in terms of being a place of safety than simply being seen as a booze bus as sometimes portrayed elsewhere in the country. I'm an inspector with Police Scotland in the Edinburgh division. I'm a part of the Compact Partnership here in Edinburgh. We got involved in this project for a number of reasons. First of all, it was a strong partnership project. There was a need for this service in Edinburgh. We were frequently getting officers taken away from core line duties to deal with medical issues and other issues which could be dealt with on the bus here. So that's why we were keen to get involved in it.
Safe Zone started back in December 2013. And we were approached to run a pilot project by Police Scotland, and working in collaboration with NHS Lothian and Scottish Ambulance. The pilot ran for 3 months, was hugely successful, and from that we've been able to get funding to run it continuously now for the next year.
Chair of the Community Safety Partnership, we work with police, the NHS, the voluntary sector on a regular basis, and when this approach came to us as a new approach to try and help people who might be a bit vulnerable in the city centre, then if we can prevent people having to use council services, the police, or ultimately go to the A&E, then we're absolutely behind that, so we're keen to take a role in supporting the Safe Zone bus.
I think because Safe Zone is very much based on supporting community safety and helping emergency services, partnership working is key to this. We couldn't do what we're doing without the support of police, ambulance, A&E, the NHS, Scottish Government, Edinburgh Council, and we help and support them as well. This project would absolutely grind to a halt without their help and support.
I think having the key people around the table that can make decisions and so we've got shared values that we work together. You know, we've obviously got decreasing budgets across the public sector. We need to do something about sharing the resources we've got, and the Safe Zone is a prime example of how that can be done, and I hope the public sector can learn from what we're doing here.
Have a very clear idea of what you want, what your aims are, where your goals, and keep asking until you find the right person to talk to.
The first thing is that police are not the main partners in all of this, and police are not to be the drivers in it. This is ostensibly a volunteer project and a third sector project, and we are one of many partners there, so it's really important to get the right people involved. It's really important that those that are driving the initiative know what people to link in with from public sector throughout the third sector, and are able to adapt and move with the times. Cost is obviously going to be a factor, so they're going to have to make some real difficult cost-making decisions as well. But really it's about getting the right people and the right partners involved.
The focus of the project is to provide welfare advice to people at the time when perhaps they're going through a major transition in their life which changes their circumstances. It may be a positive transition, perhaps they're having a baby but they're maybe having to give up work or reduce work, or they're having to maybe claim benefits for the first time to help with bringing up their child, and the cost of having a baby is very expensive nowadays. But also there's people who perhaps are diagnosed with long-term conditions which impact on their ability to work. There are people who are involved in a major trauma or an accident which then has a major impact on their life circumstances. So for them to be able to access advice at that key transition point before there's time for in terms of financial difficulties to arise. So it's a real preventative type of approach to ensure that they get advice right at the time they need it before there can be any negative impact.
I think the advantage to bringing a third sector organisation into the healthcare setting is that as a healthcare service, we understand the impact of long-term financial strain or immediate financial crisis on health outcomes and well-being for people. But clinical staff in the past have perhaps been a little reticent about asking around financial issues for people because they didn't have the knowledge or understanding of the systems to be able to advise patients on either where to look for advice or to be able to advise them on the next steps for them to take. So bringing in a third sector organisation whose sole purpose is to negotiate the welfare system and provide that expert advice and support at a time when it's really needed seems like a really sensible way forward.
One of the challenges of working in a sort of partnership and quite a close partnership relationship with the NHS is that I do feel it is important as a worker from Citizens Advice that I do maintain some independence. I do always make it clear to people I am working for Citizens Advice but working in partnership with NHS, Lothian and with the hospital to ensure that we can offer you the right, the advice you need. But I am a confidential service, and but I can also talk to health staff on your behalf. But I will only share information with them which you want me to.
I would completely agree with that, and I think that was part of how we designed the project. That in fact we supplied funding to Citizens Advice Edinburgh to employ you as a worker of theirs, so you were very clearly not an NHS Lothian employee, and actually that was a purposeful choice in how the project was set up to provide exactly that independence and autonomy as a worker. That obviously brought with it its own challenges in terms of the fact that you're working in a health site but you are not an NHS Lothian employee, and there were considerations around data sharing.
I mean, I think one of the ways in which we are working in a preventative way, in that we're sort of building awareness amongst the health teams within the acute settings about the impact of financial difficulties, but also about the impact of welfare reform. So I think that's sort of building the awareness, and actually people feeling more confident to ask questions.
We set up a clinic for drug users and women with alcohol problems, and also those who were in the sex industry. And that has really escalated over the years.
It started in response to drug users being unable to access family planning easily because they had chaotic lifestyles, and for many of them falling pregnant once they became stable on methadone, and having very complicated child protection issues. So it's trying to find a way of allowing this client group to access services that would suit their needs and where they were at the time, rather than clients having to go to services coming to them.
And we then realised that actually the problems weren't simply health, and for women to focus on their health, they really needed other things in their life to be prioritised. So we brought other partner agencies in to support us with that work and keep the women at the centre.
Partnership brings many benefits. Health predominantly work as a medical model. It has its benefits, but it's restrictive. It brings in other aspects that health can't do, but actually other agencies are doing, assets within the community are already doing, and brought them into a one-stop shop for the clients.
Partnership approach keeps the women at the centre and uses everybody's skills and everybody's experience to help with welfare, benefits and criminal justice issues. as well as dealing with health.
I think that all the agencies have a very strong focus on the client-centred approach. They work really well together as a team.
Communication can be a challenge, as well as sometimes empire building can be a challenge, that actually it's about the client and the service being at the centre and not the other partners being the centre. It's about the service itself.
For another agency who are thinking of developing this kind of service, you need to be really passionate about what you want to do. It's complex and hard, emotionally hard work, and you need to just fight for it and keep going until you get the service that you want. There are very few clinics who run in the way we do, so you need to use other people's skills.
Make sure you've got strong communication skills, you communicate and you share information with each other, but also to see yourself as a team rather than your separate services. I think that's really important, something that the clinic does really well by working on a kind of individual basis rather than representing your service almost. You're a person too.
They need to go in with the same ethos in mind, with the same focus on wanting to protect and work for the most vulnerable. They don't need to have a strong work ethic and a commitment to helping others.
One of the main aims of the initiative is to increase people's knowledge and awareness of hoarding and hoarding behaviours and how people are affected and some of the risks involved in that.
For the Fire and Rescue Service, the aims of the initiative are to raise an awareness with our own staff, how we can signpost support services onto people who are suffering from this condition. And by raising awareness with the staff, hopefully we can actually put more information out there with other partners across Scotland. And then from there, then we'll be able to increase the support services, the awareness nationally, so we can better support the people. We didn't know much about hoarding or clutter. We didn't know how to deal with it. We didn't know who to signpost it to. We didn't know any of the risks or the characteristics around it. So Linda came and gave us a presentation, and it dispelled a lot of myths and preconceptions that we had, taking us from a place where we didn't know anything, really, to a place where we can make informed choices about how to support that person in the best possible way. If we can get a task force to look at the common problems across a range of different sectors, different partner organisations, to get people to come in and discuss these issues, then we'll get maybe a common approach.
Yeah, because I think at the moment across the country, different sectors, so I'm thinking specifically about housing, health and social care, they're all kind of struggling with the same problem. So, by bringing all the relevant parties to the table, we can perhaps agree on an approach that would be better than some of the approaches that are in place at the moment to support people. One of the reasons I decided to set up as a social enterprise was really for me because it's not a money-making thing. It's people's health and well-being. It's an area that I was interested in, and I just wanted to help in any way that I could. One of the benefits of being a social enterprise, certainly for LifePod, is that I felt as if it opened doors easier for me. I think because they see that I am doing it for social good and community benefit, rather than just to line my own pocket, I guess. So I think the more kind of support organisations that work together, the better, because what you want to create is a support network for people who are affected, and know that we're all working together, for their kind of general well-being, and not different agendas, I guess. So.
I think we had and still have a very mature third sector in the city. It was used to good working relations with the council, and with other bodies it was developing, wasn't as mature as it was with the council. And we recognised that I think we had the opportunity at that moment to do something that hadn't been done before. Instead of taking the easy route, which would have been a two-way compact, we decided to really sail the boat out and have a multi-agency compact, which would really, really make a difference to the outcomes for the people of Edinburgh. And so that was the boat that we sailed off on the pond. What was interesting too was that we were in the third sector working quite intimately, professionally intimately, with organisations that we hadn't done before to look at issues. Do you remember, and I'm sure it's still the case, how supportive the police were, because they recognised very early on that the traditional ways of policing weren't successful in many areas, and that by working with the third sector they could have better outcomes in terms of people avoiding the criminal justice system.
Yes. Nowadays, more and more folk have come into councils from other walks of life, and so you see local government being run more as a business. And I think you see a professionalism of the management of the third sector as well, so that, you know, there's a more business tone to the relationships. Now that can be good, but it can also be quite bad in terms of keeping to the sort of higher order objectives.
Compact Partnership contributes a huge amount to Edinburgh in that it puts a structure on all the voluntary activity that goes on, and it says, we value you, active citizen, voluntary sector, voluntary organisations, we value you, you're very much part of Edinburgh. For Edinburgh and for the whole citizens of Edinburgh, it contributes a huge amount because it's for the whole city, and it enables active citizens to engage through various things, like through their neighbourhoods, through the various voluntary activities that they do on a day-to-day basis, whether they're conscious of that or not. It enables that kind of, what I call grassroots strategic thinking, to be encouraged and people to engage fully in their own communities and in their neighbourhoods. Well, the current environment is there is a huge gap between the rich and the poor. There's a reduction in the money that's coming to public services. There is a huge demand for those services, so it's particularly important that I think that we have a joined up approach to that across the voluntary sector, the private sector, the public sector, but crucially and absolutely at the centre of this for me is the active citizen, and a structure that takes us all forward in the same direction so that we're meeting the needs.